Churchill Retirement Living has commissioned a research project which is really understanding what is important to those over 60 from the government. This is really important because from recent research we've carried out, it's often that older people feel forgotten about and neglected. The over 60s actually account for a third of those that will vote in this year's election. So it's a really important section of the population that the government should really be listening to the needs and requirements of this group of people.
I'd like to hear what each of the candidates think about the National Health Service.
I will be the first to say it's under pressure and it's under stress, especially accident and emergency, and we will need to put more resources into it. Our argument as Conservatives is in order to put those resources in, the economy needs to be strong and growing, and we need to eliminate the deficit, because at the moment we're still borrowing more money we're still spending more money than we're earning. So the situation is that we will carry on putting in money to the health service and we will improve the services.
The NHS is one of the 5 pledges that Ed Miliband has made to the country, so we plan to employ 20,000 more nurses, we plan to employ 8,000 more GPs, we want to join up health and social care so that they are working together, so we don't have bed blocking, we don't have people who are in hospital unable to go home because social care isn't there. We want to end these 15-minute home visits that are currently in place.
So why are we sending so much money abroad to countries that don't need it?
Foreign aid.
If you don't get me wrong, I'm very happy to help the poorest in the world and to give immunisations and clean water to people who require it. I have absolutely no problem. I think in general people in this country are generous. I think they do want to help the poorest people in the world, but what they do not want is their money spent on things that they regard as wrong priorities. And frankly, I also have a problem giving money to countries that have nuclear weapons programs.
Question to all the members of the panel. If elected, what activities or what events in policies would they champion if they were elected in the House of Commons?
What are you going to do for us as the residents of Woking? My top priority, if elected, would definitely be public services. So that includes NHS, to make sure the NHS is properly funded. In the southeast, we would recruit and have an extra 1,600 GPs, for example. I do know that people have to phone up 30 times to get a GP appointment. You can't get a GP appointment same day, next day for love nor money round here.
Labour, only the other week, were saying, why aren't you paying any corporation tax, Virgin Care? Why aren't you paying any tax? And I'm afraid that shows their complete basic economic illiteracy, because Virgin Care has spent the first 2 or 3 years of their contract investing in healthcare. They haven't made any profits. That will come down the line for them if things work really well. So I think a mixed economy in our health service can produce fantastic dividends, just as it's going to do with this locality hub at our wonderful community hospital.
I would use those skills that I have as best I can. If elected as your MP for Woking. I've been involved in politics for 11, 12 years, since I was 22 and elected as a councillor, so I do know what I'm doing, but what I'm not going to do is stand up and say that I can make 27,000 different things all better. I'll do what I am good at and do it well.